Welcome to the show, Debbie. It's such a pleasure to have you here.
Thank you, June. Thank you for inviting me.
You're welcome. I'd like to start by learning a little bit more about you and your educational background. Can you tell us a little bit about how you got into nurse practitioner school?
Sure. I grew up in Greenville, North Carolina, and went to East Carolina University, got a bachelor's, and worked at the hospital there for a number of years, and then decided I wanted to do a little bit more and maybe get out of the hospital setting. So I went back to graduate school, got a master's in nursing and family nurse practitioner, and have been a nurse practitioner for about 12 years now, and enjoy the outpatient setting very much.
I'm sure you do. Well, tell me, how did you come to Brunswick County? What brought you here?
It's kind of an interesting story. My husband grew up here and has lived here all his life. I had come to visit a friend and go to the Holden Beach Fall Festival. And her friend thought Eric and I would make a wonderful couple. So I was sort of hesitant at first because, I was never one for blind dates, but it worked out beautifully, and now we've been married for almost 10 years, and everything's gone great.
Well, great. That is a nice story. Thanks for sharing that.
You're welcome.
Debbie, how long have you been practicing at Varnam Family and Wellness?
Varnam Family Wellness opened in September of 2006, and we have been very blessed to have a wonderful patient population grow ever since. I've kind of always felt that I wanted to do my own thing, and I felt like I could do that and take really good care of people. I'm still amazed that insurance companies will pay me to do what I love to do. So I just sort of felt like I wanted to branch out and do it on my own, and thankfully we've done quite well.
Now, when you started alone, is that correct?
I did, all by myself. We had 8 patients our first day, and we've just grown from there. About 2 years into it, I bought another practice in town that was closing and merged it with my practice, realized very quickly I couldn't do that by myself, and hired 2 nurse practitioners to come and help me, and they have done beautifully. One of them's no longer with us. Jennifer Culley is still there, and is a valuable asset to our team. Patients love her. She takes great care of people. We'll be adding another provider in January, Pat Osmond from Beaufort, North Carolina.
Oh, great. Congratulations.
Thank you.
Well, we've had several nurse practitioners on the show before, and I'm not sure that all of our viewers know what a nurse practitioner is. Could we talk about that a little bit and explain to our viewers the differences between a nurse and a nurse practitioner or a PA?
Nurse practitioners are always nurses first. So take me, for example, I went to nursing school first, worked for a number of years as a registered nurse, and then went back to school for additional education and training to become a nurse practitioner. So nurse practitioners are always nurses first, and we just build on that knowledge base. We tend to view the patient as a whole and not in the context of the disease as much. We view them in the context of their family, and then work to cure the disease that affects them or prevent other problems. Physician assistants are trained a little bit differently. They may or may not have a healthcare background prior to physician assistant school, but they do the same things that we do. Ultimately, the training is very similar, and we do lots of the same things.
Wow, good information. Now, at Varnam Family Wellness, I understand you have several services. Let's talk about that a little bit.
Okay. We provide health care for patients from the day after they're born. We don't do any before they're born type care.
Okay.
At the day after they're born, all the way to geriatric care.
Really?
For instance, I take care of patients down at Carolina Assisted Living in Southport. So, we carry folks through the lifespan. Our nurse practitioners are skilled in pediatric care and adult care.
So it's a total family practice.
Absolutely, totally family practice. Anything that any family practice in town would do, we probably do also.
Great. Well, that's wonderful. And today I wanted to focus a little bit on a new service at your
Okay.
practice. Can you tell me a little bit about the new medical spa I've heard about? I think it's called Arete Medical Spa.
Arete Medical Spa is a franchise and a joint venture between myself and some other healthcare providers.
Right.
And basically, Arete will operate within Varnam Family Wellness Center, but as a distinct business entity of its own.
Okay.
And Arete stands for excellence. Arete was the Greek goddess of virtue, and so the motto is excellence in care.
Excellence in care.
Yes.
That sounds great.
Yeah. So we're very, very excited to be partnering with this franchise and bringing this type of service to Charlotte.
That's a new territory, so to speak.
It is. It is. There's a few medical spas here and there. Everybody offers different services. We will sort of offer a little bit of everything. We'll be doing laser hair removal. We can do some skin resurfacing for scars with our CO2 laser.
How about veins?
We can do superficial vein care using a sclerosing agent or with the laser. We can do that. We'll be doing facials. We'll offer Image skincare products, which is
Image.
Image. It's a pharmaceutical grade skincare line.
That's quite popular.
It is quite popular. It's more affordable than some of the more expensive lines, but the quality is still there. In fact, a lot of our staff have been using it and are very happy with it.
Oh, that's a good test. You know, if
Yeah.
they've used it and they like it,
yeah.
it's much easier to talk about it with patients.
Yeah.
So that's a great
Yeah.
idea. How about Botox? Do you do Botox?
We do Botox. We typically do aesthetic Botox. You know, Botox can be used for medical purposes,
Right,
like
like
migraines,
yeah.
and for aesthetic things. We'll primarily be using it for aesthetic purposes. We'll leave all the medical stuff to the neurologists. We'll let them handle that. But we'll use it for crow's feet and the eye lines right here to help smooth those out.
Okay, and let's talk about how long a procedure like those might take, and talk about recovery time.
Okay, Botox takes about 15 minutes, and of course it varies depending on how much medication we need to use, how many injections we need to do, but roughly 15 minutes. The care is very simple. It's just a few little needle pricks. They're tiny, tiny needles. There may be some bruising. Otherwise, there's generally no effects. People can be allergic to Botox, so we want to make everyone aware of that. And if they had any symptoms at all, we'd want them to let us know. But for the most part, people tolerate it well and go right back to work.
Really?
Botox, the effects can be seen within 2 to 3 days and lasts up to 6 months.
Now, if you were going to get Botox and you needed it, say, for your crow's feet, as well as those, whatever those lines right there are called, could you do that in the same day?
Absolutely.
So you could do many different spots
Absolutely.
at the same time.
Yes.
And that would cut down on the time needed to come to the office
Sure.
and do all that.
Sure.
And post-care treatment for Botox, do you ice it down?
You can ice it if it's tender. We tell people that we don't want them to lie down for about 3 hours because we want the medication to set right where we put it.
Oh, I see.
So we don't want them to lie down for 3 hours, and we don't want them to drink alcohol for 3 hours.
How about risks? Are there any risks with this procedure?
There are risks with any procedure. Anytime there's an injection, there's risk of infection, there's risk of medication side effects. The problems with Botox administration are very rare if it's done by somebody who's properly trained.
Okay. Now, I've also seen that Arete Medical Spa will offer fillers like Juvederm and things like that. How are those different from, say, Botox?
Okay. Botox basically stills the nerve that causes you to wrinkle.
When you say stills the nerve, like makes it not wrinkle,
Makes it not
paralyze
move
it or
to
something?
cause the wrinkle.
So we can't frown?
We can frown, we can smile, and we want to.
Oh, good.
Because that makes us beautiful. So we want to smile. But we can steal the places that we don't want to move. For example, when we smile, we create some lines right in here.
Right.
And we don't want those lines always.
No.
So we can take care of those. But we don't want to do anything that changes anybody's spirit or personality
Right.
because all of that comes from inside, and health is so important.
Right. Well, then the fillers, what would be the difference?
Fillers take up space. They're exactly what they sound like. Fillers can be injected, for example, right here, where some people
What do you
have
call
deep,
those parentheses or something?
the deep lines. And basically fillers just lessen the depth of the line. Doesn't make the line totally go away. It doesn't make it not move. It just lessens the depth of it. Fillers tend to take roughly 10 to 30 minutes to administer, depending on how much we're using and how much we need for that space. We can also inject lips to make them fuller. Once you inject the filler, you massage it and rub it to shape it.
Oh.
And then we also ask that people don't lay down for 3 hours or drink
Don't
alcohol.
drink alcohol. Can you drink alcohol before? Because
We
doesn't it
don't
hurt?
recommend that. It is uncomfortable, and we give you some cream, some numbing cream to help with that.
Oh, okay. So it's not terribly painful.
It is not terribly painful, and we don't give any pre-medications to sedate people before the procedures. We do use some topical medications, but it's not painful enough that you can't do it in the office.
Okay. Well, and who actually performs these procedures? Do you have a specific provider that does that?
We have a set, because Arete is a franchise. We have a number of providers, a set number of providers that can perform these procedures: nurse practitioners, physicians, physician assistants. And I'm sure that as the franchise grows, that number will grow as well.
Will you personally be?
Yes, I will be doing the procedures. Jennifer Cully will likely be doing the procedures. And we may have other people that come in from time to time. Arete has a part of that franchise is the Arete at Home program, where we will go into people's home and do Arete parties. And that's a great way to do Botox and fillers.
So we can have a Botox party?
We can, and it'll be fun, but we don't want people drinking a lot of alcohol.
But we can't drink, right?
We have to sign consents before we drink alcohol.
Well, that party idea is something new. I've not heard of
and
that.
that's where the other providers will come in. Because a lot of times if you've got 10 or 15 ladies that want a procedure, that's going to be too much for one provider to take care of.
Yeah.
So we'll have providers come in from other areas to help us at the party.
Oh, that sounds like fun.
It does.
I'm signing up for that one. Well, can patients make appointments for the spa at Varnam Family Wellness?
Yes.
Is that how that's done?
Yes, we're going to integrate the spa appointments in with our regular appointments.
Okay.
And if we see the need, we may designate some specific time throughout the week. The spa hours can be a bit more flexible because we have more providers that can come in from other areas. So it's possible for that timing to be a little bit more flexible, but you would call the office at 754-2273 to get an appointment.
Okay, and let's talk a little bit about the makeup and the skincare products.
Okay.
Now you said it's Image.
Image, the pharmaceutical grade skincare. And we chose Image because it's safe and effective to use after you've had some sort of facial, like a chemical peel.
Oh.
There are a lot of products that you would not want to use after a chemical peel. Image is one that you can. And that's also why we chose Jane Iredale makeup, is because it is pharmaceutical grade. And you can use it right after peels, because you don't really want to have a peel and then your face be red for a week and not be able to cover that up somehow. And there's some things that you would not want to use after facials and peels. So that's the reason we chose those products.
Now it's called Jane Iredale.
Jane Iredale. And we will have both products available in the office for purchase.
And are all the providers there trained in how to choose the right colors and the right products?
Jane Iredale has a unique color match system.
Really?
And it makes it extremely simple to color match.
Really?
And all of our providers are trained to do that.
Wow. And you say they're all available at your office?
Yes, ma'am. We'll have select products available at the office. Probably every product may not be in stock all the time, but we'll have access to it and can order anything we don't have on site.
Oh, great. Now let's talk about how to get in touch with you.
Okay.
Please tell our viewers out there how to make an appointment with the spa as well as for your practice.
Okay. To make an appointment with us, you would call our office at 754-2273 and just talk to one of our medical receptionists. They will have all the information needed to make appointments with us. We are accepting new patients, particularly
Great.
our new provider that starts in January. Spa appointments will also be made by our medical receptionists. We have a website, varnamfamilywellness.com. We don't make appointments through the website yet,
Okay.
but it does have all the new patient paperwork and
Oh, it does?
information that people would need to get started so they can get all that done ahead of time. Varnam Family Wellness feels very strongly that patient education is of utmost importance. Because if we don't take care of ourselves as individuals, your healthcare provider can't do that much. I mean, there are medications and such, but the primary self-care
Right.
comes from us as individuals. So we've started a blog.
Really?
We have.
Wow, you're really techie.
We're trying. We're learning all about the tech products. So the blog is blog.varnamfamilywellness.
Okay.
And so we'll be adding to that as we go along, and that will create our patient education materials for within the office.
That's wonderful. Well, this has been a great interview. I've just learned so much about you
Well,
today.
thank you.
But I'm sure there may be something that you would like to add before we close.
There is. I neglected to mention a couple of product lines that we offer in the office that
Sure.
I feel very, very strongly about. One product line is called Luca. It's a sunscreen line, which is particularly important in our area.
For sure.
It was created by a surgical pathologist from South Carolina whose children were allergic to over-the-counter sunscreen. So this sunscreen is very well tested and very well tolerated by people with super sensitive skin. Part of anti-aging is avoiding the sunburns. So we feel very strongly that this sunscreen for people with very sensitive skin works beautifully. Our staff use it and have loved it. And there is a formulation that you can spray on your children, and it doesn't cause tears when they get it wet in the water. So it doesn't cause the eye irritation that some others do.
Right.
The other product line that we have that we're very passionate about is through Vital Plan. And that's a vitamin and supplement line that was created by Dr. Bill Rawls out of Morehead City. And we have multivitamins and specific herbal supplements, all through his company, all very well tested, very well thought out and researched products. So we're pleased to talk to anybody about those products as well. And their website is simply vitalplan.com.
Right. So once again, you are taking new patients.
We are taking new patients. We're taking new spa patients.
Okay.
And we are more than happy to answer any questions or meet with people, particularly for the spa, for consultations to determine if we can meet their needs.
Right. Oh, that's helpful.
There may be things that they would need to see another type specialist for, and just don't really know that until they sit down and talk about it.
Right. Well, thank you again for being on the show
Thank
today.
you,
It's been a
June.
pleasure. I've learned so much, and I look forward to seeing you at the new Arete Medical Spa.
Thank you, June. And we look forward to seeing you and everybody else there too.
Thanks.
Thank you.